Here's Carolyn Jarvis.
Good evening and welcome to 16 by 9. While Canada's public healthcare system may be viewed from the outside as a model for treatment, if you're one of the thousands who have had to wait months for surgery or to see a specialist, you may disagree. One of the most vocal critics of the status quo is a physician in Vancouver, Dr. Brian Day, who believes the only way to fix the system is to break the law. That's why he's providing private care, meaning you can move to the front of the line if you have the cash. Jill Kropp now with a doctor's defiance.
Meet Dr. Brian Day, one of Canada's leading orthopedic surgeons.
This has been pulled out of the bone. I'm going to fix that back down the way it used to be. You'll see us in a minute passing stitches through the tendon.
Dr. Day is often credited with introducing arthroscopic surgery to Canada, revolutionizing the treatment of common joint injuries in the process.
This is the kind of surgery that years ago that would have stayed impossible for 5 or 6 days.
A tiny camera, a tiny incision, and tendon damage is repaired in minutes. But as amazing as it seems, this is actually a fairly routine procedure. What's different about this particular operating room is, it's a crime scene.
We're in contravention of the BC law. We've known that since 1996 when we opened.
When you head to work in the morning, do you think each and every day, off I go to work and I'm breaking the law?
Oh, absolutely not. I think I'm treating patients who are suffering on wait lists. I would estimate there are between 1 and 2 million Canadians waiting for access to healthcare right now, which is far too many.
That's why 16 years ago, Dr. Day says he founded the Cambie Surgery Centre, a private, for-profit hospital, the first of its kind in Canada. The province allowed it, but only for certain groups of patients, and one of those groups is criminals.
I think most people would be shocked to hear that a federal prisoner could be brought in here for arthroscopic knee surgery with no wait. Is that the case?
That is the case. I guess one of the things we're fighting for is the right for Canadians who are not in jail to be given the same rights that those that are in jail have.
It may sound ridiculous, but it is also the truth. By law, prisoners can come here, injured workers, RCMP, and military personnel too.
And everything looks pretty good. These are the little scars here.
But not average Canadians, even those stuck on long wait lists.
So this is a 70-year-old lady from Alberta who didn't want to wait 18 months. This is unacceptable for a rich and prosperous country like Canada. We should have a health system in which everyone gets treated quickly.
At his clinic, Dr. Day does treat everyone quickly, not just those on the approved government list. The only catch, you have to pay. But charging for those services is against the law. The BC government did perform an audit of the Cambie Clinic and its sister facility, the Specialist Referral Clinic, also founded by Dr. Day. The audit, released in July, found Dr. Day had illegally billed patients nearly $500,000 in only a month for services that are covered by Medicare. When we contacted the Canadian Medical Association and the BC College of Physicians about the illegal billing, neither was willing to comment.
Universal health care, not more wealth care.
The findings of the audit did trigger protests from healthcare workers and BC's opposition health critic, Mike Farnworth.
The question is, what is the government going to do about it? Are they going to continue to turn a blind eye? Are they going to continue to play this game of don't ask, don't tell, try and sweep it under the rug and pretend it's all going to go away? Or are they going to follow the law of the land and enforce the Canada Health Act?
Cease and desist from the activity.
In response, BC Health Minister Mike de Jong announced the government would be seeking a court order to stop the illegal billing. According to critics like Dr. Danielle Martin, that should have happened years ago.
I don't really think that
the Canadian public has much tolerance for people who break the law, especially not people who break the law when it comes to the most vulnerable members of our society, those who are sick and need health care, and prey upon the vulnerability of people in those moments. I would love to see him put the energy that he's putting into extra billing the public system into improving the public system.
Dr. Martin founded Canadian Doctors for Medicare in 2006 to fight what she saw as a dangerous and growing wave of privatization.
Duly declare Dr. Brian Day as elected.
Only a year later, Dr. Day had a much bigger platform to promote privatization as president of the Canadian Medical Association.
I believe there is a place for the private sector.
Dr. Martin says that's not the answer. She fears Dr. Day's push for profit violates the sacred Canadian principle of fairness.
And when you solve the wait times in the public system, you solve them for everyone, not just those people who can afford to pay. And what we've seen in the last decade in Canada is actually when governments put their minds to it, we've seen dramatic decreases.
Well, she doesn't understand the health system. There is no need to have these tremendous wait lists that result in pain and suffering and sometimes death.
Dr. Day claims the government purposely keeps people waiting for financial reasons because it can't afford to treat everyone quickly.
Canada is actually paying to prevent people from getting treated. This is anyone's definition of stupidity, that we're actually spending billions of dollars to stop people getting into hospital.
In med school, would fellow students have voted you most likely to break the law?
Most likely to change the law, that's the way I would put it.
But he is breaking the law. And to change it, he'll not only have to fight the government and his critics, but also the memory of a Canadian hero.
Next on 16 by 9, he's thumbing his nose at the law.
They have to suffer and die on wait lists. Those laws will be struck down, and so they should be.
Now he's taking the government to court.
Years ago, Tommy Douglas helped create Canada's universal Medicare system.
I went through the hospitals, and to see there people who couldn't have got into hospital, who couldn't pay the charge to get in, now able to get into hospital, to have care without any financial barrier. They only needed one thing, and that was for the doctor to say they needed hospital care, and they were admitted.
It was arguably the most nationally significant moment since the country's birth. A law granting equal access to health care for all Canadians, regardless of their ability to pay. But in the decades since, that beloved system has begun to fray at the edges. Ballooning budgets and massive wait lists prompted government meetings, even a royal commission. Dr. Brian Day says all that talk has failed. So for the last 16 years, he's been promoting for-profit health care. And now he's taking his crusade to court.
What I want is a quick end to the problem. It's not going to come from politicians debating and fighting. It's going to come from the legal system making an objective decision that this isn't good enough for Canadians.
Dr. Day's clinic has been brazenly flouting the law by allowing patients to pay out of pocket for surgery. But he says that law is unconstitutional.
We have no doubt that Canadians will be emancipated, that the draconian laws that tell a citizen in a free and democratic society that they cannot spend their own after-tax dollars on the healthcare of themselves and their loved ones, and that they have to suffer and die on wait lists, those laws will be struck down, and so they should be.
Dr. Day isn't going it alone. Patients like 18-year-old Chris Chiavati are joining him in court to tell stories of long and painful wait times.
It's frustrating, if I had to sum it up in one word.
Chris was only 14 when he tore cartilage in his right knee at school during gym class. Suddenly, he couldn't do many of the things he enjoyed. In fact, he couldn't do much of anything.
It was really beyond the point of physical activity hurting me. It was day-to-day life hurting me, which is really a big issue. To me, that was sort of the line in the sand.
It only took a few weeks to get an MRI, but getting a specialist appointment was a different story.
We were about 400 on a list waiting to be booked for an appointment.
After nearly a year of waiting, Chris and his family decided to pay Dr. Day to perform the surgery. Today, his knee is nearly good as new, the scar almost invisible. But that brush with the system has left a lasting impression.
I feel it failed me. They deemed my procedure an elective procedure, but it wasn't elective to me. I had to have it done, and as soon as possible, right? Because I was in a lot of pain.
It's those stories of long, painful waits for surgery that have prompted Dr. Day to challenge the constitutionality of Canadian healthcare laws. And that argument has already proven successful in a similar case in Quebec.
People should have the fundamental right to choose for their own health.
In 2005, a Montreal doctor named Jacques Shaouli successfully challenged laws that prohibited patients from buying private health insurance.
When I was practicing medicine, I saw a lot of patients suffering or dying on the waiting list. And I felt that as a doctor and also as a citizen, I had a duty to do my best to help my fellow citizens, and that is what I did.
Bruce Johnson was one of the lawyers in that case.
On the one hand, the government says this service is being offered, but it is not being realistically offered because, in fact, people have to wait forever to get it.
The Supreme Court ruled in favor of Shaouli and granted Quebecers the right to buy private insurance. But that decision didn't extend to the rest of the country. So Dr. Day is headed back to court. He's confident he'll win, but wishes Ottawa had stepped in years ago.
Is the court the place where this should be decided?
Oh, absolutely not. I would have much preferred if we'd had some leadership from politicians, but they don't want to take risks and they don't want to do anything that requires a bit of courage, even if it's the right thing to do.
But critics say privatization is exactly the wrong thing to do. Dr. Danielle Martin leads a coalition of healthcare workers called Canadian Doctors for Medicare.
If we allow this move towards for-profit in the Canadian healthcare system, I think it's going to damage the system substantially.
Dr. Day insists it's actually the other way around. Canadians' health being damaged by the system. And he says the government shouldn't be trying to stop him from treating patients who want to pay.
It's unethical of the BC government to be attempting to stop that.
But they're still trying.
They're acting unethically.
Dr. Martin says it's Dr. Day who's acting unethically and that money is a big factor.
I think greed is something that we need to guard against. There's no doubt that Dr. Day makes a lot of money doing what he's doing.
I wish. I'm 65 years of age and still working, 12-hour days, and it's not because if I were wealthy, I wouldn't be doing that. I wish I were wealthy, but I'm not.
Depending on who you ask, he's either a hero or a villain. But no matter which side you're on, there is a critical decision coming. And when the time comes, Dr. Day is confident a change is coming too.
If you support the status quo, then you are supporting a system that is killing patients. This is something the Supreme Court of Canada said, not Brian Day.
And that is our broadcast for tonight. I'm Carolyn Jarvis. From all of us here at 16 by 9, thanks for watching and have a great weekend.